scenario: a mother brings her 4-month-old infant for a checkup. She notices the baby can hold their head up but cannot yet sit. Which principle of growth and development explains this progression from head to toe? This follows the cephalocaudal principle, which dictates that development proceeds from the head downwards to the lower parts of the body. 2. Case scenario: a 2-year-old child living in a region with high food insecurity presents with a weight significantly below the 3rd percentile. In the overview of growth, which factor affecting growth is most likely responsible for this presentation? The most likely factor is nutrition, which is a critical environmental factor that directly affects a child's physical growth and weight gain. 3. Case scenario: a 10-year-old boy is concerned because he is the shortest in his class. Both his parents are also short, and his medical history is unremarkable. Which factor affecting growth is the primary driver in this clinical case? In this case, genetic factors, heredity, are the primary influence on the child's growth potential and ultimate height. 4. Case scenario: a pediatrician is evaluating a 9-month-old. The doctor checks the child's ability to pick up a small piece of cereal using the thumb and index finger. In the assessment of development, what specific milestone is being checked? The doctor is assessing fine motor development, specifically the pincer grasp, which is a key milestone in developmental monitoring. 5. Case scenario: during a growth assessment, a clinician records a 12-month-old's weight, length, and head circumference. Why is head circumference specifically monitored in the periods of growth and development associated with infancy? Head circumference is monitored because it serves as an indirect measure of brain growth and development, which is most rapid during the first few years of life. 6. Case scenario: a 15-year-old girl presents with a rapid increase in height and the development of secondary sexual characteristics. Which period of growth and development is she currently experiencing? She is in the adolescent period, characterized by a significant growth spurt and physiological changes driven by hormonal factors. 7. Case scenario: a mother is worried because her 18-month-old child is not yet walking. In the assessment of development, how would this clinical finding be categorized? This would be assessed as a gross motor delay, as walking is a major milestone expected by this period of development. 8. Case scenario: a clinician is using a growth chart to track a 3-year-old's progress. They notice the child's height has dropped from the 50th percentile to the 5th percentile over 6 months. Which section of the lecture outline does this monitoring activity address? This falls under the assessment and monitoring of growth, specifically identifying deviations or disorders of growth. 9. Case scenario: a 5-year-old child is unable to speak in full sentences and has difficulty following simple instructions. Which domain should be the focus of the assessment of development? The focus should be on language and communication development, as well as cognitive assessment. 10. Case scenario: a child is born with a congenital heart defect and subsequently experiences slow weight gain. Which factor affecting growth is illustrated by this medical condition? This illustrates organic, medical, factors, where a chronic illness interferes with the body's ability to grow normally. 11. Case scenario: a doctor observes an infant's social smile at a 2-month-old checkup. In which category of developmental assessment does this social interaction fall? This falls under social and emotional development, which is a key component of a comprehensive assessment of development. 12. Case scenario: a 7-year-old presents with a height that is more than 2 standard deviations below the mean for their age and sex. What is the clinical term for this disorder of growth? This is clinically referred to as short stature, which requires further investigation into potential endocrine or nutritional causes. 13. Case scenario: an infant fails to regain their birth weight by 3 weeks of age. Which disorder of growth and development must the clinician rule out? The clinician must evaluate the infant for failure to thrive, FTT, a condition where growth is significantly below expected standards for the period. 14. Case scenario: a clinician notes that a child can throw a ball overhand and jump in place. These skills are part of which developmental assessment domain? These are gross motor skills, which involve the coordination of larger muscle groups. 15. Case scenario: a student is asked to list the principles of growth and development. Besides cephalocaudal, which principle describes development moving from the center of the body outward? This is the proximodistal principle, which states that development proceeds from the near center to the far extremities. 16. Case scenario: A 4-year-old child who was previously toilet trained begins wetting the bed again following the birth of a sibling. What is this clinical phenomenon called in the context of disorders of development? This is known as developmental regression, where a child loses previously acquired milestones, often due to emotional or psychological factors. 17. Case scenario. During the assessment of growth, a clinician calculates a 10-year-old's body mass index, BMI. What is the purpose of this specific monitoring tool? BMI is used to monitor for nutritional disorders, specifically to identify children who are underweight, overweight, or obese for their age and height. 18. Case scenario. A newborn is found to have a very low birth weight despite being born at full term. Which factor affecting growth likely occurred during the prenatal period? Factors such as maternal nutrition, health, or placental function during the prenatal period could have affected the intrauterine growth of the fetus. 19. Case scenario. A clinician explains to a parent that growth is a continuous but non-linear process. Which part of the lecture outline covers this concept? This is covered under the principles of growth and development, highlighting that children grow at different rates during different periods, such as infancy and puberty. 20. Case scenario. A 3-year-old cannot draw a circle or use safety scissors. Which area of the assessment of development should the clinician investigate further? The clinician should investigate fine motor and visual motor integration skills,